What is confirmation bias in OCD behavioral experiments? Imagine trying to solve a mystery but only paying attention to clues that support your suspicions, ignoring everything that might tell you otherwise. That's similar to what confirmation bias is in OCD. It's a mental shortcut where people with obsessive-compulsive disorder tend to focus only on information that confirms their fears or beliefs. They might see neutral events as proof that their worries are true, even when there's no real evidence. For example, someone worried about germs might touch a doorknob and then think they've definitely gotten sick, even if they wash their hands afterward and feel fine. Their brain filters the experience to reinforce their fear, making it seem more real. In therapy, especially in cognitive behavioral therapy, behavioral experiments are used to challenge these fears. These experiments involve testing beliefs by deliberately engaging in situations that trigger OCD thoughts or by resisting compulsions. The goal is to see what actually happens, rather than what the person fears. But confirmation bias can make this tricky. If a person believes not checking the stove will cause a fire, they might do the experiment and see nothing bad happen. Still, they might interpret this as the experiment being inconclusive or think that the fire is just waiting to happen. They might ignore the clear evidence that their fear isn't coming true and instead focus on any tiny sign that supports their worry. This bias makes it harder for people with OCD to change their beliefs because their mind is naturally inclined to look for proof that confirms their fears. That's why therapists carefully design behavioral experiments to help patients see the evidence more clearly. For example, they might set up situations where the person can test their fears in a safe way and then review the results together. Over time, this process helps reduce confirmation bias by showing the person that their fears are often unfounded. It's a gradual way to weaken the faulty belief system that keeps OCD going. Understanding confirmation bias is key in treatment because it explains why simply telling someone their fears aren't real doesn't always work. The brain's tendency to seek out confirming evidence can make it seem like the fears are justified, even when they're not. By recognizing this bias, therapists can guide patients to interpret their experiences more accurately. This helps them see that the evidence doesn't support their obsessive thoughts, which can lead to fewer compulsions and less anxiety. Remember, everyone's experience with OCD is different, so personalized therapy is always best. If you or someone you know is dealing with OCD, talking to a mental health professional can provide tailored strategies to challenge confirmation bias and improve quality of life.